Welcome to this tutorial. What we're covering today is your question. Obviously, it's your questions. I've had some more really good salient questions. As you know, last week we covered returning to work, and the one element or the one area in the UK that was holding out was Scotland because of Professor Leach's statement about complementary medicine. So, excuse me a second, I don't think that's me, but just in case, oh, it might be, right, sorry, turn my phone off. Yeah, so Professor Leach was holding out based on the idea that each complementary medical discipline needed to be assessed scientifically in order to work out whether you were safe to return to work. Now, I took a little bit of issue at that because he hasn't scientifically assessed whether hairdressers are allowed to return to work, or barbers, or other close contact services and disciplines. So, you know, it's a little bit, you know, I'm just a little bit not sure about quite what his agenda is. Anyway, I'm sure, you know, let's look on the bright side and assume it's all about keeping everybody safe, and that he just wants to know a little bit more information. But at the moment, unless anything dramatically changes in Scotland, it looks as though we're all okay in Scotland to return to work. I believe, Roberta, it's the 22nd, I believe, isn't it? I think that's what they've said most recently.
That was in the latest route map, yes, it was.
Yes, that's it. And as I say, they haven't specifically said complementary medicine, but I think we can maneuver them to the point where they will actually admit complementary medicine and possibly actually list it. But at the moment, I think, you know, we can pretty much assume, because we're alongside and all the other countries have set a precedent whereby we are kind of lumped in with close contact. So obviously, there are different types of complementary medicine. And so, of course, you know, it's a different situation for people who are doing distance therapies, like, say, homeopathy or nutrition, or things like the psychotherapies, those sorts of approaches whereby you don't have to be hands-on with your patient or your client. Whereas, of course, obviously the likes of the acupuncturists, the massage, reflexology, and so on, you know, obviously there is that much closer hands-on contact. So I have some sympathy for their position, but by the same token, you know, I think they need some clarification, because, you know, we are a really important contributor to the health and well-being of the nation, and also, let's not forget, the economy of the nations as well, you know, all of the nations. So, you know, I think it's absolutely crucial. So that's where we are at the moment. So I just wanted to give you a few updates, really. As you know, over this time, you know, we've been doing lots and lots of different tutorials. And we've given you the best data that we can possibly give you, all things being considered. So, you know, we will underscore the fact that COVID-19 is a very fluid situation. So it's really important, you know, we can only give you the information sort of as and when we receive it. But of course, as professionals, you know, the onus is also on you to make sure that you are practicing within the remit of your guidance and law in your own jurisdiction, whichever country you're from. So I've got pages and pages of notes here. So I'm going to go through those, but some bits and pieces that I wanted to just sort of make some statements for you, because I think these are really quite important. I first of all also actually wanted to thank you for your immense patience at this time. We know it's been incredibly challenging for you. We're not resting on our laurels, because, you know, there is a possibility, we really hope not, but there is of course a possibility that there may be a second wave, and I have some thoughts about that which I'll share with you towards the end. And also, because we're a smaller group at the moment. You know, if you want to ask questions, or if there's anything I'm saying that isn't clear, then you are more than welcome to unmute yourself and ask a question or put a question in the chat box. If you don't know, if you've not been with me before, if you roll over your screen, mouse over your screen, the chat is at the bottom. You just click on that and it brings up a white, in my case on my screen, actually no, it's not a white chat box because I changed my screen colors the other day. So it brings up a kind of a panel at the side where you can actually input your question if you don't want to ask it out loud. Either way is fine, I don't mind whichever. So I just wanted to say, you know, you've been amazing. Your questions have been amazing. Your patience and fortitude has been absolutely amazing throughout this unprecedented time. So I just want to thank you and to congratulate you for being just so professional and just so, I think also very forward thinking, insofar as I know that what you've been doing is looking at, you know, okay, so we can't do anything right now with our practices, but what can we do to kind of maybe reevaluate our practices, maybe look at finessing our websites, perhaps finessing our messages. Of course, we've been helping you with, you know, all of those tutorials on things like, you know, your avatar, your niche, your website, your branding, and all of those wonderful things. So I hope that that's all been really helpful for you. And if you remember, right back at the beginning of lockdown, we were looking at ways, and I was looking at ways that I could actually help you pivot so that, you know, what can you be doing so that you've still got an income and you're still working whilst we're actually in lockdown. Of course, that was the very beginning. We had no idea how long it was going to actually last. And so hopefully some of that information was helpful, and that some of you have been able to take certain elements of your practice online. And what I think the first ever tutorial I gave was actually how to set up an online training course, which I know is really close to a lot of people's hearts. And I really want you out there sharing your expertise, because again, if we go back into lockdown, you know, we're emerging now, but, you know, look at Leicester, look at Lancashire, you know, they've been in and out of, you know, individual lockdowns. So we just don't know. This is the problem. So I really want to make sure that you're stable and that you know ways that you can pivot to keep going should the worst happen. Okay, so don't forget, we are here, Roberta and I and Megan and the team are here. If you need to chat with us, if you've got any questions for us, we're always here to support you. And the nice thing about the CMA is that when you contact us, you'll always get an immediate response, whether it's by email or on our social medias, or if you pick up the phone, you'll always get to speak to a person. If we're away from our desks, we do call you straight back. You know, you know, we really, really believe strongly that supporting people is crucial, more so now than ever. So I just wanted to cover that and just to, as I say, to thank you. Right, let's just have a little look. I've written I've got 6 pages of info for you, so I just want to make sure I'm pre-seeing it, but I don't want to miss anything. As you know, all of the sessions we've done so far, I hope you know anyway, they're all up on the Complementary Medical Association's YouTube channel. So if you are, you know, if you're thinking, gosh, blimey, my earrings just dropped off. If you're one earring, if you suddenly think to yourself, gosh, you know, I really would like to maybe go back and revisit that tutorial, or I missed one, they're all there for you, completely free, totally free for you to access. If you go to YouTube and search Complementary Medical Association, you'll find all of the videos and tutorials that we've done so far, and a lot of other really useful information besides. So my best advice and my best trick really to recommend would be to say to you, when you get there, there's a red box and you click on that. It says subscribe. So click on that to subscribe. It doesn't cost anything. It's not a subscription or, you know, anything like that. And but when you do, a little bell icon will pop up and it will allow you to click that little bell, and it will alert you when we upload a new video for you. So we will keep doing that, you know, as things change within this situation. So, right, okay, so the questions, I want to move straight to the questions. And then what I'll do is talk about the various checklists that we've prepared for you. We've actually found some really quite useful things online as well. So we've got things that we've put together, but also things that other organisations like the World Health Organization, British Medical Association, and other organisations, legitimate, you know, organizations of good standing, I suppose we could say, that they've put together for you as well. So the first question is from Mandy. Right, okay, she's got a question about the statement from Balance. Now, I'm assuming that you're all on the CMA Facebook pages, where you'll have seen that we posted the latest, the link to the latest info from Balance. Balance is one of our insurance companies, and the other is Westminster. Balance have bought things. They kind of stayed still a little while they were waiting to gather more data, because obviously they are the mouthpiece of their underwriters. They're simply the supplier of the underwriters' products, insurance products, so to speak. So Balance were a little bit slow in coming to the fore, but we did ask them to update their website, and so they did very kindly. We love Balance, don't get me wrong. I'm not doing, you know, I don't want to be doing them a disservice. We do really like them. They are so good. They're so on the ball. You know, and I think they didn't update things because they simply didn't have any further info at the time. Anyway, so we gave them links to the further info and said, look, can you look at this and make it, you know, check with the underwriters and make a statement. So they have. So Maddie's question is, does it mean that we can give Reiki to clients from this week, the 13th of July, but stay away from high-risk areas, such as the face? Or we cannot give Reiki face-to-face as it's classified as high risk? It seems that Balance are only covering insurance if not done face-to-face. Does that mean I cannot practice face-to-face as I will not be insured? To clarify, Mandy, this face-to-face thing is a little bit like, now I've never seen anybody doing Reiki literally face-to-face like this. I've never seen it. I don't think it's necessary in Reiki. We know Reiki is a hands-on or hands-off treatment. I don't think you need to go absolutely close-up face-to-face like that. There are some questions regarding Reiki transmissions where air is blown into certain chakra points depending on the lineage and the training of the practitioner, as we know. So I think, you know, there are other ways of doing transmissions, and quite a lot is being written about that. I'm not a Reiki master myself, and so I am not the best person to advise you about other ways of doing transmissions if you're teaching. So I would suggest you go and look for alternatives about, you know, the actual sort of blowing of energy, or I suppose healing forces and Reiki forces into another person. But, you know, this face-to-face thing is really where you've got lash technicians who literally do have to lean over you in order to put those incredibly tiny eyelash extensions on. That's really what they're talking about as regards face-to-face. Okay, so it's much, much closer than really any of us as practitioners would probably get, unless I'm very much mistaken, and I'm more than happy to put my hands up and say, okay, yeah, you know, that you do something that I didn't know about, so, you know, so forgive me for that. But, you know, if I've got it wrong, put a note in the comments, please, or the chat box, because I think that I've covered it, and I hope I have. Rachel very kindly wrote in and said, hi, Janie. Could we talk about government guidelines for working on the neck and head as a practitioner? Interesting, isn't it? So it's, and some, you know, a few other people actually raised this as a question again, because they'll have seen these points come up as, and it's really a nod to the beauty industry. So, you know, lashes and brows and tattooing and all of that sort of thing. As practitioners, you know, and I would always say, protect yourself and your patient. You know, we're talking about visors, we're talking about masks. I tend to think more PPE is better than less PPE, if you're okay with that and it's not going to make you pass out. I would say, so really, Rachel, I would say, I think I've covered that, and I imagine you're probably not working totally close up. But if you are, put a note in the chat box, please, and explain if I've misunderstood that, because I may well have done. Okay, so the next question is, a lady's a member of another organization, and they've not really been very forward thinking with the advice that they've been giving. So she's got a couple of questions. Again, I'm pre-seeing here. Right, okay. She says there's a lot of guidance for therapists that work from the clinic space on what they should be doing. However, I'm a mobile therapist and I'm struggling to find much guidance on how I should be conducting and what to include on my risk assessment and just general best practice guidelines while I'm at a client's house. She also goes on to say, I also have a number of clients over 70 who want me to massage them, but there does not seem to be clarity with regards to whether GP consent is a must or a guidance. I believe the government guidelines do not require GP consent, but would this be something best asked to the insurance company or her organisation? Well, the problem is, I know which organisation she's talking about, and they've not been making any statements at all, which is a real shame. So I feel if she's going to ask them a question, she's probably not going to get an answer. So let's answer it here from the CMA perspective. There are no requirements, talking about people over 70 who are in a vulnerable group. There are no requirements as far as law is concerned to get GP consent in order to work with people in a vulnerable group. In a way, my kind of practice development side of things and where I'm coming from as somebody who's passionate about helping you to build your practice, I would always say it's great and a really good idea to liaise with somebody's GP if that person gives you permission to do so, and you need to get that in writing, as you well know. Okay, so I would suggest liaising with the person's GP with full permission is always a good thing to do. You have to bear in mind, though, that the GP may not be up to speed with current government advice and guidelines because they are so busy. Let's face it, they're so busy just sorting themselves out and their own practice out and trying to make sure that all of their staff have PPE and are protected and trying to get back to work properly, that they may not even have given complementary medicine a second thought. So, you know, it may be that you hit a bit of a brick wall speaking to a GP, but nevertheless, you know, if you reach out to a GP, it's not always a bad thing at all. So I would actually say that it's probably an idea just to make an inquiry, but if you get rebuffed, don't worry about it too much. It's probably coming from somebody who doesn't really know very much about what we do. If the person who's over 70 is happy to receive a massage from you and they are happy and able to wear PPE and so on, a mask and what have you, whatever you feel that you would like them to wear, then that is probably an absolutely fine situation. We've not heard anything to the contrary from the insurers. And also the question regarding being a mobile therapist, I covered this last week actually. It's very difficult to do a risk assessment when you are a mobile therapist. When it's your own environment, you can control the environment. If you're going into somebody's house, then you've got to obviously bear in mind that they will be feeling safe within their own environment. So what you've really got to do is to A, ensure you're not bringing anything in with you by way of infection, but B, that you are protecting yourself in that situation, okay? So if in doubt, go back to last week's tutorial where I did cover it all in some depth. But yes, I really hope that that actually helps, just to cover off those questions. So let me put this bit to one side, and I'm just going to check in the question box. Okay, right. Okay, so let's just catch up on these questions here right now. This says, I'm a facial reflex therapist and fall into the same category as beauty therapy, facial treatments in terms of closeness of work. Fair enough. Okay, so you know which category you're in, so therefore you know what the government guidelines are to enable you to get back to work. Whether you're working doing a facial or whether you're working far, far closer and doing things like lashes and eyebrows and so on. So I think there's a little bit of a difference between the two, but you need to satisfy yourself to that effect. Wendy says, I was under the understanding that we were not allowed to work on the face or neck. I'm a burn therapist and neck and face work is sometimes needed. I was under the impression that we could be arrested if we do so. I've not seen that you could be arrested. I'd like to see if you've got a link to that. Bear in mind, you know, we're not infallible. There may be something out there that we've totally missed. I doubt it, because, you know, we've been through page after page after page of government information and guidelines across all the different countries. I also need to know which country you're in as well. You know, it may be that if you're in America, you know, you could be under some more draconian rules. So I don't know exactly where you are, Wendy. So if you can just clarify that, that would be helpful. But no, I've not heard about being arrested. And also, again, it's very much down to your relationship with your client. I'm not talking about flouting rules, because I'm absolutely not talking about that. What I'm talking about is making sure that you and your client are safe. As we know, beauty salons are allowed to come back to work, but you know, there are certain guidelines about working very, very close, you know, doing very close work. So just look at that, be very, very clear about it for yourself, and that will actually give you the guidance that you're after, I feel. Right, okay, Kim says, right, oh, yes, okay, Kim, you did say, thank you, you did actually say that you had to dash off, and you did warn me about that earlier, so thank you for coming in even briefly. It's lovely to see you here. Carol says, are there specific guidelines about clinical waste, masks, visors, plastic gloves, couch roll? Yep, I'm coming to all of that, so hang fire. Okay, lovely, right. Sharon says, hi Sharon, I'll be doing a kinesiology intolerance test on Monday for a 22-year-old type 1. I presume that's diabetic, but it's a bizarre typo. I'm sure it's a diabetic. Right, okay, yes, that's absolutely fine. I mean, obviously we know that type 1 diabetics are in a high-risk category. The good thing is, of course, that this person, being a 22-year-old person, is actually in the lower category. So, you know, as long as your PPE is on point and that you're protecting yourself so that you know that, A, yourself, you are safe, and that the person you're working with is safe, and that the person is actually also properly kitted up and PPE'd. There's no reason why that kinesiology intolerance testing shouldn't actually be perfectly valid. There are so many different ways of testing in kinesiology, as we know, so you're going to have to be creative with the way that you work, and also, of course, obviously, you know, just calibrate your testing so you know that the results that you're getting are actually accurate. You obviously need to calibrate before you actually go in and do the tests themselves. So do that, make sure you're, you know, following your practice by the book, and you should be absolutely fine with that. Okay, oh, thanks, Wendy, you're in the UK. Yeah, so I've not heard about people being carted off or arrested. I've heard that people could be fined for deliberately flouting the rules. But it's, you know, I think if you're sensible and you're not breathing and really right up close into somebody's face, then, you know, you're using your professional expertise to deliver a professional service. Okay, so just make sure that you are a decent and sensible way away. If you can't deliver your treatment by not being up close in somebody's face like this, then don't do that treatment. You're going to have to wait. You know, I can't be any clearer than that. You will have to wait. Okay, Sharon says, oh, okay. He didn't realize, oh, that's talking about Sharon's type 1 diabetic. He didn't realize that he wasn't vulnerable until I told him he's happy to have treatment. Should I just get him to sign a disclaimer? He has been living life as normal. Well, in a way, good on him, and in a way, silly, silly boy, because everybody with type 1 was pretty much told you are very, very vulnerable. So I don't know how he missed that notification, but, you know, 22-year-old lad, what can you do? I think it's what happens with 22-year-old lads, to be quite honest with you. So I think, yes. In fact, actually, for all CMA members, as a CMA membership benefit, we are creating forms. One of the forms that we've created for members is actually a disclaimer that you can use. So we'll be getting that out to you on Monday. Yeah, so we've got a few bits and pieces that you can actually that you can actually utilize, and we've put bits in it so you can actually brand it up as your own, and all of that sort of thing. So it's really, really useful. Right, okay, so with the absence of any further questions in the chat box, let's move swiftly on, because we've still got more pages to go through. The next question from Juliet says, my question relates to mask wearing. I work as a theta healer and have started client sessions which are seated consultations with good social distancing and windows open for good ventilation. I've noticed my clients are uncomfortable and struggle to talk and indeed hear me clearly enough for an hour or particularly a 90-minute session. It's difficult to keep asking to replace the mask in position rather than having it resting on their chin. This is worrying me, and I don't know whether to insist or listen to some of the government information which doesn't recommend masks for office workers. That's a really difficult question, Juliet. If it's proving to be too difficult for people to keep a mask on for the full 90 minutes, maybe think about reducing the consultation time, really cutting to the chase and getting in and getting out of the treatment as swiftly as you possibly can. And I know that theta healing can be done very, very quickly. So it may be that you might want to rethink the structure of the sessions, possibly. Go back to charging and fees though, because I'm not saying that if you reduce the session time that you should reduce your fee structure or anything like that, because you are all of you, not just Juliet, you're all still offering the most amazing, valuable service. Remember how I constantly bang on about the value that you bring. You know, you've got to really appreciate the transformation that you bring as practitioners to your clients. So I don't want you reducing rates. I don't want you commoditizing your offering and just making it yet another Me Too. Oh, I'll give this a go. It might work, it might not. You know, any of that sort of thing. You've got to appreciate what it is that you bring to the party, what you offer your client. So if you're unsure about any of that, go to the CMA YouTube channel. All of the videos are there. Have a look at how to structure your fees. There's also, I think, if I remember correctly, I did a session on establishing your branding, understanding what your brand stands for. There are also elements of this. Oh, in profitability, I did a special session on profitability as well. It's all there for you. So please, 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 although we're all looking at getting back to work, I do not want you downgrading and commoditizing your practices. This is about practice development. If we're positioning complementary medicine as a force to be reckoned with alongside conventional medicine, then you have to make sure that what you're doing is offered in the most professional way possible. Okay? Here endeth the sermon on that. Well, I might come back to it because you know I'm passionate about it. Right, okay, so we've got another question here from Deborah, and I caught it out of the corner of my eyes. I'm just going to address this one as well. Deborah says, quite rightly, I'm really concerned about the coagulopathy issue with massaging clients, especially asymptomatic clients. I believe bailiffs have confirmed that the onus will be on the claimant to prove you were negligent. Bearing in mind all of the articles regarding COVID-19 and related coagulopathy, surely this means the claimant would have a case as it's a recognised issue. How do others feel about massaging clients? Do you believe we would be covered if we made them aware of the related issues, asymptomatic issues, and they still confirmed that they had not had COVID and were happy for the treatment? I would possibly think about adding that to the disclaimer. As I say, the disclaimer that we're giving you is like a sort of, it's a basic one. You can add anything you need to add. The coagulopathy issue I did actually cover last week. And I think if you've got a client that you know has had COVID, then I think it's really worth your while actually pointing out to them the risks. I personally, I don't do body therapies, but if I did, and I had somebody who'd had COVID, would I massage them? No, I probably wouldn't actually. I probably would suggest other forms of therapy. But, you know, you've got to make that decision yourself. And as Valence rightly say, the onus really would be on them to prove that you were negligent and that you were the person that caused this problem, rather than them having, you know, literally walked into something and knocked themselves and a clot comes loose. You know, these little micro clots that we're talking about in the main. So, you know, there are so many reasons why a clot can travel. So, you know, it would be the most unbelievably difficult thing to ever prove that you were the person that caused this problem. But because we want our patients to stay safe, I think possibly offering massage services to people who've had COVID. And let's face it, there aren't, I mean, I don't know about you, but there aren't vast numbers of people coming to you who've had a confirmed diagnosis of COVID-19, who are also looking for massage therapy. So I would be interested in this group. We've got 34 people in the room at the moment, just out of sheer interest, because I think it's an intriguing thing. Can I just ask how many of you have actually had people who have definitely been tested positive for COVID? If you can just write in the chat box, I would be really, really curious to actually know. Because it's, you know, we know that a lot of people have had it, but it's, who knows? I just don't know. We don't know the scale because nobody's ever done the research. So, right, okay, let's have a little look at some of the responses. Yeah, none, agreed. Yeah, Deborah's completely ruled out anyone who has had COVID. Concerned about asymptomatic people. Yeah, Bianca's had none. Sharon's knows 3 but hasn't treated anybody. Yes, you're right, actually, Deborah. You know, yes, you're right. So Deborah says she's completely ruled out anybody who's had COVID, but concerned about asymptomatic people. Yes, you're right. Do we know that asymptomatic people have coagulopathy? Because the thing is, how would we know if they're asymptomatic? We can assume they may have coagulopathy. Does coagulopathy happen in people who are asymptomatic? I don't know. I actually don't know. I don't know if anybody has that information. And we can certainly go away and research it. Of course we will do, but I really truly don't know the answer to it. So we need to find out. Right, okay. Carol, what's the stance on track and trace? I'll come back to that in just a second, Carol. Barbara says that she knows of 2 from the same family but hasn't treated anybody. Debbie hasn't treated anybody. So it's a bit of a, you know, with the confirmed cases, none of us are treating anybody. With the asymptomatic people, we need to find out. Roberta, would you make a note of that if you haven't done so already, if you don't mind? Because I think I want to go away and look at that, because I just don't think, you see, I don't even see how anybody would do that research to say, you know, you may have had COVID, but you don't know. Could you come in and be tested in case you've got coagulopathy? I just don't think it's been done. But anyway, don't quote me on that because we'll find out for sure. Okay. Yeah. Helen's given a craniosacral treatment to someone who had COVID 3 months ago. She had a negative test earlier this week. Yeah, exactly. It's so interesting, isn't it? Yes, Karen says she hasn't treated anybody but knows of one person. I personally know of one person. So it's, but she's not a patient, she's a friend up in London. So yeah. Okay, so going back to the question on track and trace. Carol, when you say what's the stance on track and trace, do you mean as far as, and you're worried about client thank you for clarifying, you're worried about client confidentiality issues. Yes, it's an interesting one, isn't it? I think really the onus is on us as practitioners to say, you know, if somebody says to you, if somebody confides in you and says, I may have had COVID or I've got COVID-19, I think really you've got to then actually direct them to their GP practice who will look after that side of things for you. I don't believe that the onus is on us to do the government's work on tracking and tracing. That's not our job. I really don't think we should even get involved in that, because the pitfalls, the potential pitfalls are so massive. I don't want to put any of us at risk or in harm's way of doing something wrong. Can you imagine? Because, you know, the problem with the track and trace system was they just didn't realize, nobody actually sat and did the maths and realized that if one person has been in contact with 6 people, then how many people have each of those 6 been in contact? And suddenly they were into the millions, weren't they? I mean, only it's a few steps away and suddenly you're into millions of people. And they realized that the track and trace system really wasn't fit for purpose. So, you know, certainly not our job to do that. So I would suggest you tell the person to go back to their GP, and the GP will be able to work from the framework of notifiable diseases and that sort of position. I don't know whether actually the government statement on laws about notifiable diseases have actually been updated to include COVID. They should have been, but they might not have been. So it's really interesting. So yeah, I'd say don't take the onus upon yourself. It's not your responsibility. It's your responsibility to tell the person to tell their GP. I think that's the most sensible way of approaching this. Right, okay, let's have a little look. Helen says, I thought it was okay as craniosacral is such light. I was going to say exactly the same thing, absolutely. It's such light touch. If I was a massage therapist, I wouldn't give a massage to somebody who had had COVID. I'm inclined to agree with you, yes. Mandy says, should we check clients' temperature before we start treatment? Yeah, you know, with the CMA disclaimer, guidelines, intake form and so on, we do actually say you get the person to check themselves and have they been in contact with anybody and so on and so on and so on. And so, you know, that is, we can pretty much assume when they're coming to see you that they are being honest with you. If you feel you would also like to check their temperature, it's easy for you to say, put the teeth back in, check their temperature, then why not? I think it's absolutely perfectly okay for you to do that. Not forgetting, of course, that COVID can produce a low-grade temperature. So, you know, just obviously be sensible about that and realise that a low-grade temperature may still signify COVID, or it may signify a hot flush if you've got a menopausal lady. So, you know, just use your best judgment. Deirdre says, right, I'm concerned about track and test. I'm in Scotland, so not working from it yet. Okay. Right, okay. Right, okay, so the question really is, if we're wearing full, I think that's supposed to say PPE, are we exempt from being tracked? Just worried about opening and then having to close again for 14 days. Yeah, it's a realistic problem, but you know, it's the same for anybody running any kind of a cafe or a shop or a bar. You know, if somebody's walked into that cafe, shop or bar and they then turn out to have COVID, then that place has to close. You know, it's a risk we have to take as far as being in practice is concerned. And I don't know that you'd be able to say to the powers that be, yes, but I was wearing full PPE, gown and visor and mask and gloves and all the rest of it. I just don't know whether that would actually hold any water. So again, I think you've got to look, as you're in Scotland, I think you've got to look very carefully at the rules in Scotland. The only reason I can't give you a definitive answer is because I've not seen a ruling about this that says one way or the other. But I'm just assuming that they would treat us like any other retail unit or outlet. And yes, you would have to close, and everybody in your shop or your salon or whatever it is would need to actually, you know, be sort of furloughed again, you know, just back to sort of square one. Horrible situation. We just have to try not to have anybody coming through our doors who suddenly is in the situation where they've developed COVID. It's very difficult, and I feel as I'm giving you very woolly answers, and I'm trying not to. But the problem is, without evidence, you know, we have no further information than the government has, so we're just giving you our best advice based on government guidelines at the moment. So I'm sorry to say that, yeah, you know, if the worst were to happen, yes, you probably would have to shut down and then start from scratch again after 2 weeks of quarantine. So, you know, just bear that in mind, and you may, as a result, want to think about you know, what your strategies will be in order to actually let somebody over your threshold. So just have a good think about that and sort of work back from there. Helen, hello Helen. Helen says, as a homeopath, I've supported 10 people with COVID, all done virtually. Yeah, this is the luxury that we homeopaths have, isn't it? You know, we are very, very fortunate. Psychotherapists, counsellors, you know, we're all very, very lucky and very, very privileged that we have the ability to work with our clients without being hands-on. So yes, well done you, and thank you for sharing that. Also, of course, you know, as homeopaths, we're not going to dislodge any of these little tiny clots or anything. So, you know, we are very lucky. Right, okay. Helen also says, some of her COVID patients only had a temperature for a very short period of time. So I don't think temperature is a good guideline as to whether anyone has COVID. No, in fact, in the guidelines that I'm going to point you to on the CMA website, we've actually got a whole symptom checklist that's absolutely bang up to date. So again, I want you to refamiliarize yourself with the new information about symptoms, symptomatology. Okay, so it's all actually there for you. I'll give you all the links to that at the end. So yeah, you're absolutely right, Helen. I completely agree with you. It's not a great guideline, you know, but then again, we've got to take the totality. Speaking as a homeopath, we've got to take the totality of symptoms. So, you know, have they got a temperature? Have they had a temperature? Have they got a dry cough, persistent dry cough? Have they got any other symptoms? You know, and the problem is at the moment that you've got things like hay fever mimicking a lot of the COVID type symptoms. It's quite difficult to actually do a differential diagnosis, isn't it? Right, okay, that's great, Deirdre. I'm glad that was useful. Right, Maureen says, sorry, I know that you've covered this already in the UK. Can I carry out facial therapy massage? With massage therapy, would I have to wear gloves and aprons? Maureen, where are you? Are you in the UK? I'm not sure, because I'm not sure from your message. I know you've covered this already in the UK. Oh, you're right, fine, you are in the UK. Okay, lovely. So yeah, again, it depends entirely how close you have to get. Are you like this, face to face, as an eyelash tech would be? You know, they're leaning right over you, or are you at arm's length? I think this is the thing. You know something, I wonder, and I've done this myself in the past with certain homeopathy patients. Not so much now because everything I do is online, but I had a problem, I'm going back years and years ago, with male patients starting to get a little bit frisky and, you know, bit dodgy. These things happen. So actually I then put in my notes all sessions or appointments are videoed, and I said for record keeping and teaching purposes, and they were actually also used for teaching purposes, and you have to give your permission. This will not go anywhere other than to my students that I'm supervising and from my own records. But you know, I wanted to, you know, if anything kicked off and it became an insurance issue, because in the CMA we've only had a couple of problems in 27 years with people question mark, have they possibly been inappropriate with a client? One chap, it actually turned out that he had been, but he was doing all sorts of other treatments as well, not under the auspices of the CMA. So, you know, we gave evidence, but, you know, it didn't really ever come over to us because he was doing all sorts of bizarre practices that really weren't complementary medicine. And that's where he was assaulting people. And another chap who's been a CMA member for a really long time, he's an acupuncturist, and he was just complete, you know, it turned out that he was absolutely fine and in the right because he'd seen fit to actually record sessions. So, you know, I think it's not a bad practice to do so. So if you are giving treatments to the face, head and neck, you might actually want to think about explaining to people why you're actually record keeping, perhaps by maybe recording the session. So that if it ever went to court and somebody said to you, oh, you massaged my head, and no, I've got COVID, you can actually demonstrate that you are fully covered with all your PPE, you're doing all the government guidelines, and you are working at arm's length. It's a thought. You know, again, these are just kind of best practice thoughts. There are no guidelines in law. There are no, you know, recommendations even from the government about how to do these sorts of treatments. You know, as a professional body, we have to give our best judgment on this. And so that's how we would actually, those would be our recommendations to you at the moment, until we get further guidance, you know. And as soon as we get further guidance, you must keep your eye on the CMA website. You must also check in all the time on the CMA Facebook pages, because that's where we can get really immediate, bang up to date information to you. Also, make sure, if you're not already, that you are subscribed to the CMA newsletter that we send out every week on Wednesday morning. Okay, so if you're not yet subscribed to that, go to the CMA website, give you the details at the end. At the top, there's a little purple box. You click on that and you can subscribe to the newsletter. And that's another way that we keep you totally updated with everything that's going on. Right. Okay. Yes, Christina says rashes can appear with none of the other symptoms. Absolutely. You know, it's a bit of a minefield, but you know, if only there were a reliable test, but there isn't, which is why you have to use your best professional judgment. Okay, so let me just check and see what else I've got in my little list here. So we've covered the Bayman statements. We've got COVID checklists on the CMA site, which you're welcome to use. That's absolutely open for everybody, regardless of which organisation you're a member of. It's all there for you. We've also there got links to things like NHS guidance and the HSE guidance for PPE, the type of PPE that is ideal, ways to put it on, ways to take it off, because there are systems for doing all of these things, and disposal and laundering and all of those things that you need to get your head around at the moment. Track and trace we've covered. I wanted to talk about that because it's quite important. So I've got lots and lots of links here. All of these links, as I say, are on the relevant CMA page. So things like COVID, up-to-date symptoms and best practice from the British Medical Journal. They've got a great up-to-date patient leaflet, which is really helpful. We've got a really handy Scottish Government checklist for the retail sector, which actually really is useful for us as well. So again, it's on the CMA site. I'd like you to check that out as well. Although it's covering Scotland, it's really handy. It's a checklist. It's really, really handy for everything that, you know, we're all doing across all 4 countries of the UK and further afield. They've got a few little typos on it, but we'll forgive them for that. But you know what I'm like with typos. I'm just so anal about typos and things like that. So, you know, just bear with it, because I'm sure they'll fix those, because I wrote to them and told them. Mrs. Angry from Hastings. Right, okay, so yes, I wanted to cover what happens if there's a second wave, which I'm going to come to towards the end, because I think it's more appropriate to put that there. Right, okay, so, right. Oh, thank you, Roberta. Yeah, Roberta's put the website details up. That's brilliant. Thank you so much for doing that. Right, okay, so, let me see. Okay, I wanted to just talk to you about walkthroughs. I know that we've covered these, but also I want to give you some thinking points at the moment, just to go away and just kind of, you know, mull over, just to make sure that you're up to date on all of these. So I'd like to consider the following. Do you need to adapt your business premises and treatment areas? What do you do if you are a visiting practitioner, if you're going to on-site visits? What if you're going into vulnerable places like old folks' homes and so on? You know, what steps do you need to take in order to make sure that you're not just protecting yourself, but you're protecting people within those environments? Do you need to make any practical changes to the actual way that you deliver your therapy, treatment, or your consultations? So does that mean to say that you need to change the way that you physically work? Do you need to put kind of screens or barriers up? Could you possibly deliver certain elements of your work online, thus protecting yourself and your clients even further? Do you need to spend more time between clients to decontaminate areas? Yes, you probably do, especially if you're hands-on. Do you need to update your aftercare information, or even your pre-appointment information that you send out? Really take a look at those, a good long hard look. If you've been staring at them for so long that you're going cross-eyed, maybe get somebody else, you know, a friendly friend or neighbour or family member to take a look at it, to say, does this make sense to you? Have I missed anything off here? Because, you know, I know this myself. You know, I'll write something up and then I'll send it to Roberta, or perhaps we'll send it over to Megan, or send it to other people within the team and say, can you just read this through? Does this make sense? You know, because when you've been staring at something for ages and ages and ages, it's a bit like, you know, if you spell a word and then you look at it and think, is that right? Especially if you're tired. Is that right? And it starts looking weirder and weirder and weirder. It might be spelled correctly, but, you know, if you stare at something for a long time, you can sometimes actually miss things as well. So do just get other people to check things over for you. Get a fresh pair of eyes on the subject. Do you need to make any special purchases in order to further maintain cleanliness? How will your new way of practicing affect the more practical elements of the way that you run your business? So again, things like fees, cash taking, card processing. Do you take payment up front online? Do you get people to make a PayPal transfer? That sort of thing, a BACS transfer, any of those. Think about getting those strategies in place. Do you need to put any updates on your website or leaflets to reflect any changes? I'm sure you probably do. Have your insurance needs changed in any way? Have you made an inventory of everything within your practice and workspace that could possibly be a source of cross-contamination or infection? Think about where people place their hands. It's really quite surprising. We suggest a walkthrough. I know I spoke about this last week, and I also spoke about it a few weeks ago. It's really important that you actually physically do this yourself. Do a walkthrough of your practice so you can check that everything is covered, that you're decontaminating everything right from the front door bell to the back door and all points in between. So we've created a checklist that you can actually work through. But you know what? We don't know your practice. So there may be things that you spot and think, gosh, there's that leaflet dispenser there. Hadn't thought of that. I need to decontaminate that. Just to think really laterally about worst case scenario. I think it's actually quite a useful exercise to imagine that your client is a really hyperactive toddler, and that they're coming in and they're putting everything everywhere. And from that perspective, you could probably actually quite adequately decontaminate. Right, okay, so let's have a little look. Right. Yeah, we've actually seen some CMA practitioner members making YouTube videos where they explain to their clients exactly how the premises will be sanitized between each appointment. I think that's brilliant practice. If you can do that, it proves to your clients, and also, of course, if you're running training, classes and so on, all of this information applies to you with your students as well. If you can get some sort of confidence in what you're doing and show that you're really adhering to government guidelines, that doesn't just engender more confidence in the way that you work, but also it shows if anything were to happen, you can actually show the insurers and say, well, look, this is what I put up, and I insisted my clients actually watch, so that they know exactly what I'm doing to keep them safe, and that also that I explained what I expect from them in return, and so again, it's yet another safeguard for you. And do you remember, I always say, keep a paper trail. Back it up. Don't rely on your computer to keep your paper trail on. If you've got an email going to your patient or your client or your student explaining what they have to do before their appointment, and then you get a response back from them and you've asked them to respond to accept your terms and conditions in order to keep them safe, you've got to keep a note of that, and please keep a second copy, perhaps in the cloud, just in case something dreadful were to happen to your computer and you've got the dreaded blue screen of death if you're running an IBM PC, or if you get the interminable spinning beach ball on your Apple, you know that you've got a record of that somewhere, just in case. You know me, belt and braces all the way. Right, okay. Layout in that letter, in that pre-appointment letter to them, email, what have you, exactly what you expect. Are they bringing their own mask? Are they bringing their own refreshments? Yes, please do. Get them. Don't give them refreshments. Get them to bring a bottle of water if they need water, that sort of thing. Tell them if you expect them to bring PPE of their own, gowns or anything like that. Just make sure that you're managing your boundaries. You're setting your boundaries and you're managing them, managing expectations every step of the way. If you can do that, then you're doing brilliantly. We all like to know what the boundaries are, don't we? It gives us that sense of security and safety. I think it's very, very important. So, right, okay, I've seen other questions coming up. I just want to check. Just bear with me 1 second. Okay, oh, that's lovely, Roberta. Thank you very much. Oh, yes, Roberta, thank you. You must also look into what can be claimed as business expenses on your tax return. Yeah, absolutely. Thank you, Roberta. I actually wouldn't have thought of mentioning that. So thank you very, very much. That's really important. So that's why we call her Wonder Woman. And Janet says, I know all soft furnishings that can't be washed need to be removed, but does that go for curtains too? They're unlikely to be touched by clients and needed for privacy. Well, yeah, you know, that's a really interesting question. Yes, I mean, theoretically, well, the problem is, again, because there's no data, what we don't know is how long, if somebody was to cough on your curtains, if they were rude enough to walk up to your beautiful curtains and cough on them, we don't know. Nobody knows how long the virus stays virulent or transmissible on different types of surface. Nobody has that data. So what do we do? What's our best professional guess? We would have to assume that your next client is not going to come in and rub their face on your curtains where that person's just coughed. So I would say, if you are in your practice room and you've got curtains for privacy and so on, if you are opening your curtains and closing them and you're wearing gloves and you're doing your hand washing procedures and so on, chances are you probably are perfectly safe in not needing to keep washing those curtains. If you think about it, if you've ever been in hospital for any length of stay, they actually tend to have paper curtains now, which are all disposable. But before that, they used to have cloth ones. And in some wards now, they actually do still have cloth curtains. And, you know, those are not consistently washed. Those will stay up for several days at a time. So we can assume that if hospitals don't believe that those are vectors of contamination, then, you know, and you know, we're not all going to go and rub ourselves up against those curtains, then we can assume that it's probably reasonable for you not to have to decontaminate your curtains. With other soft furnishings, yes, I mean, I would strip down. Do you remember last week you said strip everything bare, take everything out that's removable, so that it just makes your life easier between the turnarounds, you know, between appointment turnarounds. The less in your room, the less you have to do, so you can be faster at actually decontaminating everything. Okay, so, right, let's have a little look. Okay. Deirdre says there's a website called Drew's selling non-toxic sprays for surfaces and aerosol sprays and misters for your rooms for clothes and surfaces. Have those been proven, Deirdre? I don't know, so it's Dew, so I'm going cross-eyed. The problem is when you're doing these things, the ring lights are so blooming bright. You have to have them, but they're so blooming bright, you end up going cross-eyed. It's a website called Dew, D-E-W, selling non-toxic sprays. Right, okay, they sound great. Deirdre, I don't know them. Have they been shown to kill COVID-19? I kind of doubt it at the moment because, you know, it's such a novel virus. But it may be that they've been shown to, you know, kill other types of coronavirus. So we could possibly extrapolate, but we probably don't have any proof. We do know that we've got to look at 60 to 70%, ideally 70%. Proof alcohol content, proof 70% alcohol content in order for something to be a decontaminant. Even then I've got doubts. Right, okay. And Juliet says, if I choose to provide a plastic visor for clients as an option, is it okay to clean it with alcohol and recycle for other clients? Yes, actually, I mean, alcohol is used to decontaminate. So yes, if you've got a handy bottle of alcohol, you know, nearby, and I'm talking, you know, medicinal grade alcohol, not your bottle of gin, but you probably actually would rather have with your tonic after work. So I would say, yes, you know, just use your, again, best practice guidelines, use your best professional expertise. In homeopathy, we use really, really powerful alcohol to make medicating potencies. So personally speaking, I would use that. It's something, can't actually think what proof it actually is, but it's nigh on 100% alcohol with very little, if anything else in it. So yeah, you know, you can actually get those. In fact, I ordered mine from Boots. So you might want to check there and see if they can actually get it for you. Because I don't think it's something you can order necessarily online. because it's so highly flammable. I mean, it really is seriously flammable stuff, so you've got to be careful with it, but it would do the job, that's for sure. But again, look into this dew. Again, I don't know about it, but it's worth, you know, Deirdre says about it, it's worth checking out. Right, okay, so Helen says, I have a sofa in my treatment room that I can't remove, so I've covered it in plastic. Yeah, great. I mean, that's fantastic. That's very, very sensible. Just making sure that you can decontaminate it between people sitting on it. Fine, yes. Janet says, is it possible to use a UV light? Well, you know, I don't know. I know that there are lots of UV lights. In fact, I have a friend who deals in these, and he has sold millions, I mean, tens of millions of pounds, if not more, into the Middle East, in hospitals in the Middle East, where they actually have a form of UV light that they put into aircon units and air purifying units that circulate air and decontaminate it. They also have these UV wands that you can wave over surfaces, and it's supposed to get rid of absolutely everything. Now, I would like to see the data on that. These units are pretty expensive, and I think for it to really be a proper hospital grade decontaminating UV light, it's probably really blooming expensive. So I would tend to probably go old school and just use plain old boring alcohol, or, you know, other things that we know have been shown to be good as decontaminants, such that if your insurance company was to say to you, well, this person says you might have given them COVID, you know, what steps have you taken to make sure your room is absolutely clean and pristine? You can say, well, haha, I've used this particular product. It says X, Y, Z. So again, it's all about keeping your records, making sure you've got that paper trail. So to answer your question about UV light, I just don't know. I think, you know, we do know that there are types of UV light that will decontaminate, but, you know, I really don't know that I could recommend a form to you that's cost effective enough without it costing you many, many tens of thousands of pounds. So it's possibly a non-starter. Right, you can use couch roll on fabric chairs. Yes, you can. That's right, change it in between. Not sure, but our local hospital uses their products. Oh, dew, is that right? Yes, okay. Videos on their website explains the product. That's great, Deirdre, thank you for that. So we'll all check that out. It sounds really good, especially as they're natural. It sounds ideal. Right, okay, so disposable, Janet's saying that she uses disposable massage towels on fabric chairs. Lovely, brilliant idea. Deborah says, is it okay to have carpet flooring, or would you need to replace with hard flooring? No, I think you're fine with, do you know what? What if you've got a little crawler? What if you've got an ankle biter that's come into your room with mummy or daddy? Or you're seeing the little one themselves. If you've got a little one crawling around on your floor, do you know something? I would put some sort of disposable covering on your floor if you've got a little one that's actually going to be crawling around on the floor. Personally, I would rather say to mummy or daddy or whomever they've come with, actually, could you just hang on to them so that they're not all over the floor, pop them back in the wheelchair, in the pushchair, that sort of thing. Yeah, I personally think that, you know, it's not necessary unless you've got somebody getting down on your floor and getting, you know, down and dirty with you know, sort of what's been traipsed through your practice room. So yeah, you know, I don't think the virus is going to jump. You know, viruses don't jump. They don't have legs, so they're not going to jump off the floor into your face. So I think we're okay with that. But as I say, the caveat being, if you have to get the person down on the floor for some strange reason, I don't know what, or if you've got a little one that's going to be crawling on the floor, then just, you know, use your brain, you know, use your common sense. Right, okay. Nails Materials sell 99%, 99.9% isopropyl alcohol online. So they've got a way of shipping it to them. That's brilliant. There never used to be a way. So that's fantastic. Great. So we know that we can do that. So we'll have to look at Neil's Materials, because that would be the best thing that you could possibly use if you want to use an alcohol wipe. Kathy has to go. Thank you, Kathy. Thank you for coming. It's been brilliant. Let me just look through, because we've got to the end of the session. So I just want to look through all of these pages. There are more pages here, but these are all pages that are on the CMA website. These are all the checklists and so on. So it's all there for you. To find it, what you'll do is you'll go to the CMA homepage, and then right at the top there are 3 boxes: a purple box, a blue box saying coronavirus, and then another purple box. If you click on the blue box, and it does actually tell you underneath COVID-19/coronavirus CMA latest update. If you click on that, that's where you'll get all of these pages and pages and pages of notes. I'm sorry, it's an awful lot of information for you, but I would rather be really thorough than actually, you know, miss anything out for you. I think it's so important that I keep you absolutely up to date, and that everybody's totally compliant and in line with the government guidelines. Absolutely crucial. We've also got lots of lovely links for you, things like citizens advice if you're struggling to get any sort of support. Let's have a little look. We've got best practice, British Medical Journal. We've got patient leaflets, British Medical Journal. We've got all the government websites telling you what is allowed to be open and what isn't allowed to be open across all 4 countries of the UK and other countries as well. World Health Organization coronavirus updates, Royal Society of Medicine. I would say check out the Royal Society of Medicine. They have got amazing free webinars which will keep you up to date with the latest development on coronavirus and a bunch of other topics. Now, I'm a fellow of the Royal Society of Medicine, and so we are doing a quid pro quo with them because with the CMA, as you know, with all the information that we put out, all of our articles, all of our latest research and so on that we share with you in the newsletter, everything, as you know, is evidence-based, and everything we talk about within complementary medicine as far as possible is evidence-based. So they, at the Royal Society of Medicine, have actually said that they will help to promote our webinars and tutorials as well, which is a massive step forward for complementary medicine as a whole. So, I mean, it's just amazing. We're very, very privileged. No other organisation is linking in with the RSM or the BMJ or the BMA or the GMC like that at all. So we're very, very, we're very privileged to be in that position. But I think it's because of the hard work that we do in order to make sure that we're giving evidence-based information and keeping everybody, clean and clear and legal as far as everything is concerned. So that's really exciting. And the other thing I just wanted to say was, what do we do if we go into lockdown? If we go into lockdown again? So I've been giving this an awful lot of thought because I wouldn't be surprised if we get a second wave. And if we get a second wave, I think we will go back into lockdown. So, what do we do if that's the situation? I want to have everybody maneuvering to a position whereby you pivot your work so that you are largely able to operate online. Whether that is you teaching courses or whether that is you pivoting your practice so that you can actually continue to serve your patients online. Tricky if you're a body worker, but there are ways and means that you can do this. So that's what I'm going to be putting my mind to next. Okay, so there's an awful lot of work that I need to go away and do in order to come back to you with further guidelines and further support. But do remember, I've got that whole library now of tutorials that if you haven't been through them, please make time, because they will have you viewing your practice or your training school in a completely different light. It will just kind of give you thought exercises that will enable you to actually re-strategize should the worst happen and we get this second wave. I'm actually putting together a course as well, because people have been asking for it for some years now, because we used to do real live workshops, face to face and so on. I think that we can't rest on our laurels and assume that everything will be open in order for us to all get together, as lovely as that would be. I don't think we can all necessarily, assume that we will ever have that luxury. And I'm sure in the fullness of time, maybe in a year or so, let's hope that this virus just mutates itself out of existence and that we don't then get another one come along that puts us all back in lockdown again. I mean, we just have to keep positive and assume the best, I think. But we are going to put together an actual blueprint, a literal A to Z of everything you need to do step by step by step to pivot your practice, to get your practice online, to set up training courses, how to do public talks and all of that sort of thing. So I'm going to make sure that gets done for you so you have that resource, okay? So before I let you go, so I don't want to let you go, you're all so amazing, and I just want to thank you for your brilliant questions and for, you know, keeping the faith and doing these tutorial sessions. It's been absolutely brilliant. And I just want to say, you know, just before we go, are there any further questions? Is there anything else, anything I haven't covered, or anything that you need any further help on? If you want to pop it in the box, that's fine. I'm just going to check the list here. Okay, super. Right, okay, that's great. Lovely. No, I think we're all good. Just want to say thank you so much. All your lovely. It's so nice seeing everybody's names coming up and so on. So I just want to say thank you very, very much. Thank you, Roberta. I don't know if everybody realizes it's actually Roberta's day off on Fridays. And bless her, she's been taking all this time out to support these tutorials. And honestly, it would be blooming difficult to do them without her. So Roberta, I just want to get everybody, can we please join in a big round of applause for Roberta? Because I really think she needs one. Thank you, Roberta. I know she can't hear you because you're all muted. Yeah, thank you guys. Thank you so much. She's just absolutely amazing and wonderful, and we're so lucky to have her. So I just want to say thank you so much, everybody. Lots and lots of love. Have a brilliant weekend. Remember that you can always phone us, you can always email us, you can always just pop us a message on social media, and we'll get right back to you. Okay, take care. All the best, everybody. Lots of love. Bye. See you soon. Bye.